Whoa. Hello. Sorry it's so dark in here. I'll see what I can do about that. Okay, yeah, I'm post-migraine at the moment, so that's lovely. Yeah, I had epic migraine of doom yesterday, so I'm keeping things in the apartment as dark as possible to hopefully prevent that from making a resurgence. Yeah, for 24 hours after I have a migraine, I'm always sort of at risk of it flaring up again. Yeah, no chocolate, onions, or bright lights. Yeah, this video really is in relation to a GP appointment I have tomorrow that I'm quite nervous about. Yeah, I've been pushed into a position where I had to take things into my own hands in terms of my pain medication regimen, and I hate that. My GP is difficult when it comes to opioids. He has a problem with them. But unfortunately, I need them in order to function, in order to have a life. You know, I'm 25 years old. I don't want to be stuck in bed every day just because everything hurts. Yeah, a little while ago, I was prescribed 5 milligram Targen to go with the Oxynorm that I was already taking. My pain increased dramatically, and it did so rather suddenly. That sort of coincided with when things with my spine started to flare up. So, I mean, you know, that makes sense. Yeah, the Oxynorm, I was taking too much of it, and it wasn't lasting long. It lasts 4 to 6 hours, it says, but realistically it only lasts 4. It never lasts 6 hours. Yeah, I didn't want to be taking so much of it, and I didn't like that it was making me sick. So I went to my pain specialist and told him I needed something more long-term. We were hoping that increasing my Lyrica, the medication I take for my fibromyalgia symptoms, would mean that I could keep the Targen in reserve, that I wouldn't have to take it every day. That didn't happen. So under my GP's guidance, he would only relent to letting me take, a Targen in the morning and Oxynorm before bed. But the Oxynorm is still making me sick, or was. I'm aware that spike dosing or peak dosing, which is when you only take quick release opioids, and you do it in response to, you know, acute pain or breakthrough pain. I'm aware that that increases the risk that you'll develop a tolerance. It's actually much safer to take something slow release all of the time. So I didn't feel that I could go to my GP and say, I need to do this, please support me, because I didn't expect that he would. So I needed to trial it and see if it would work. And now that I know it does, I can go to him and say, I've been taking, you know, my 5 milligram Targen every 12 hours on the dot and keeping it in my system at all times, and that's working for me. Yeah, but I'm still worried about how he's going to react. For people who take opioids for chronic pain, one of our biggest fears, and I mean terrors, is that a doctor at some point will turn around and say that we're drug addicts and that they're taking us off the pain medication that keeps us sane. Yeah, if I didn't have access to opioids, my pain would be unmanageable and it wouldn't be worth living. Yeah, if you're in that much pain all of the time, and there are things in the world that can reduce it, but you've been denied access to them because people don't believe your pain exists or is as bad as you say it is. My God, yeah, that's nightmare scenario. Yeah, Jesus Christ. Yeah, I'm really worried that he's gonna respond to me asking for an increase in my pain medication like that. And in terms of everything else to do with my health, he is a fantastic GP. He's gone to great lengths to learn about my various weird conditions, which, you know, in all fairness, are pretty unusual. although not as uncommon as it's believed. Ehlers-Danlos Syndrome is actually a lot more common than the current statistics indicate. That's something that we're learning now. It's just underdiagnosed. So he may well treat other EDS patients and not realize that he does. But as far as I'm aware, I'm his only EDS patient at the moment. So, yeah, you know, he's one of those GPs who can admit when he's wrong. And in the medical profession, that's quite unusual. I mean, it's unusual in terms of people in general, but there's a lot of ego in medical professions. And it's a serious problem for people like me who, I'm an educated patient. And I don't just mean in terms of my biomedical science degree or, you know, my human genetics major. I mean that I have been educating myself about my condition since I was diagnosed, you know, and even before that, because I was diagnosed at 17, even as a teenager, I was researching and trying to figure out what was wrong with me. Yeah, I mean, it's hard getting access to pain management when you have a diagnosis, let alone when you don't. So that was interesting. But yeah, I have an appointment to see my pain specialist, but I can't get in to see him until the 5th of September. Because I'm taking the Targin every 12 hours instead of once a day, I am going to run out before I can get in to see him. So I need my GP to prescribe me, you know, to prescribe me more. And I don't know how he's going to handle me having taken matters into my own hands in terms of my pain medication. Yeah, I've never known him to be so obstinate about anything. You know, it's weird the way he reacts in terms of opioids. It's just, it makes me wonder why he has that prejudice. I mean, I know the way GPs are conditioned in terms of opioids is unfair. There's a lot of pressure on GPs to weed out people who are drug seekers. And, you know, if they prescribe opioids to a patient who turns out to be a drug seeker, they are held unfairly responsible for that. I mean, they're not psychics, and it's unfair to expect them to be able to read their patients' minds. And, you know, it's pretty easy for a patient to lie to their doctor. You know, they can say, oh, no, I'm not getting any side effects from these high doses, you know, please prescribe me more, when actually they're suffering terrible side effects, but they're ignoring those side effects because it means they get more of the drug. That is addiction. In my case, I'm taking Targin every 12 hours because I want to protect my pain receptors, because I'm going to need pain medication for the rest of my life at increasing doses as I age. And, you know, the oxynorm was making me sick. I was unable to keep food down sometimes. Like, that's awful. You know, I mean, having to choose between pain and being able to eat. Yeah, that's not easy. Honestly, if I had to choose, if I didn't have an alternative, I would choose the pain. I need to eat. I need to eat in order to take my other medications. This isn't something I can compromise on. But thankfully, I had enough Targin that I could do this experiment and see how it would go. Yeah, I'm so anxious about how tomorrow's going to go. Yeah, I'm going to record another video after the appointment tomorrow to kind of recap, but hopefully I'll have good news then. Yeah, I just wanted to kind of use this as an opportunity to highlight the whole drug-seeking thing. It's only a minuscule number, comparatively, of patients who are on opioids for years and years and years who develop addictions. But we're all sort of victims of the attitudes created in response to the patients who do abuse them. And that's unfair. And it hurts us. It harms us. It damages our quality of life. I actually knew a woman who killed herself because she was branded as a drug seeker and denied access to pain medication, and it drove her to suicide. And that terrified the rest of us, of course, you know, seeing what her family went through, because doctors wrongly assumed that she was a drug addict. So, yeah, in light of those fears, wish me luck.